Welcome back. Let's return now to our top story and a new report that's concluded that poor care in maternity services is frequently tolerated as normal. Let's take a look at some of its key points. Well, one of the proposals is to implement a strategy to recruit and train more specialist maternity staff and ensure they're given mandatory training in trauma care. The report also calls for a base standard in maternity services across the UK to end what's being called the postcode lottery of care. The review says a maternity commissioner should be appointed, reporting directly to the Prime Minister to ensure accountability, and there should be universal access to specialist mental health services for all mothers after giving birth. Well, joining me now, medical negligence solicitor Elizabeth Malakal. Thank you so much for joining us, Elizabeth. My first question is your headline takeaway from the report. Were you shocked by its findings, or were you quite aware of some of the issues that are clearly ever present across the nation?
Thank you, Wilfred. Sadly, we weren't shocked by some of the findings. As a solicitor who specialises in medical claims, the conclusions reached in the report are something that we see all too commonly. Problems with communication between staff and patients, problems between staff and breakdowns in relationships, problems with mental well-being are all too common in the area of work that I do.
Is this postcode lottery aspect applicable in other areas of NHS care?
Yes, I think it is. There are massive health inequalities in all aspects of medical care, not just maternity claims. We see health inequalities based on ethnicity, we see it based on neurodiversity, we see it based on socioeconomic groups, and we see it based on geographical and regional variations too.
I'm interested in the recommendation to appoint a maternity commissioner that reports directly to the Prime Minister, and I can totally see the attraction of doing that to try and boost accountability, try and boost the level of attention it gets. Do you think that's a workable solution, and should a reporting line via the Health Secretary be sufficient to try and solve some of these issues?
The call for a maternity commission, we believe, is a good recommendation, but much will depend on what powers that maternity commissioner has. We already have a patient safety commissioner. If the maternity commissioner has power to enforce change, to increase funding, to connect all the relevant stakeholders who are already engaged in maternity services and hold trusts and management to account, then yes, it is a good idea. It's unclear what specialism the maternity commissioner would be, but if it can hold trusts to account and increase funding, then yes, we do think it's a good idea.
It's interesting looking at all the recommendations and of course, the headline one I just mentioned of recruiting and training more maternity staff. They all cost money, of course, and your practice does look at all sorts of areas, and I just wonder whether you think that the maternity area is the area top of the list that needs that funding, given the context we all know, and that the NHS probably could do with funding in all areas.
That's correct. I mean, from looking at it from a claimant clinical negligence lawyer's perspective, the budget for claims runs into the billions, and the vast majority of that is spent on maternity claims, particularly in relation to injuries to babies and specifically brain damage. So whilst, yes, we accept that resources need to be applied across the NHS and fairly, the damage caused by failures in maternity care can be so catastrophic that extra funding is absolutely required, and as soon as possible.
And do you have hope that will now happen following this report and its recommendations? Clearly, that is the hope. Is there confidence?
There's confidence has been lost in maternity services across the country. We've had lots of reviews of maternity care, Shrewsbury and Telford. We've had East Kent. We've had Morecambe Bay. And whilst lots of recommendations have been made, we see the same mistakes, the same themes, and the same issues arising. What we hope that the parliamentary inquiry recommendations will do, and the recommendations coming out of the report, is to unify all of those stakeholders' reports and investigations, and to connect them all, and to make improvements and to make them fast.
And do you have any recommendations yourself that haven't come out of the report, or is this a report that you think strikes all the right notes?
It does strike all the right notes. It is a holistic response to the problems that we see in maternity care. It covers medical records and the digitisation of the records. It covers recruitment and staffing issues. It covers looking after the mental well-being of mothers, but also of partners as well. It involves primary care in terms of engaging GPs in antenatal and postnatal care, and educating women as to what to expect as part of their conception, pregnancy, labour and delivery as well. So it is a holistic response to the issues faced in maternity care. Definitely, yes.
Elizabeth Malaikel, thank you so much for joining us.
Thank you.